Moving a client up in bed return demonstration. First thing first, you should perform hand washing.
Good day, dear. By the way, I'm Cañadora, a student nurse from Asian College of Technology, and I will take care of you from this day. For safety purposes, may I hold your hand so that I can check your ID band, okay? So, you're Jason B. Cañadora, Feb 3, 2010, room 303, okay? By the way, dear, for today's session, I'm going to move you up to your bed, okay?
After that, you should provide the client privacy. Moving unable patient up to bed. After explaining the procedure to the patient, remove the pillow and place it at the head part of the bed. Reminder, 2 nurses should support the client. Make sure the client should cross arm under his chest. Then, 1 nurse should slide the forearm under the patient's upper arms, near the axilla, and other to his hip and abdominal part. Next, by the use of signal, lift the client toward the head part of the bed. And lastly, return the pillow and fix linens before leaving the unit. Moving unable patient up to bed using the lift sheet. After doing hand washing and explaining the procedure, remove the pillow and place it at the head part of the bed. 2 nurses should position to the side of the bed. Next, loosen the lift sheet and place it under the patient, extending from the head to the buttocks. Cross arm of the patient and carefully move the client into lateral position. Carefully move the patient into its original position, and then cross arm again and carefully move the patient into lateral position, and back again to its original position. Next, grasps the lift sheet and by the use of signal, lifts the sheet toward the head part. Return the pillow and tuck the lift sheet. And lastly, tidy the place and leave the patient in a comfortable position. 3. Carrier lift. First thing first, you should perform hand washing.
Good day, ma'am. By the way, I'm Cañadora, a student nurse from Asian College of Technology, and I will take care of you from this day. For safety purposes, may I hold your hand so that I can check your ID band, okay? So, your May Almacen, December 12, 2003. So, room 302, okay? By the way, ma'am, for today's session, I'm going to transfer you from bed to stretcher. And I need the assistance of my 2 fellow student nurses. So, this will be quick and safe. All you have to do is need to trust us, okay? And I'm going to call out my 2 student fellow nurses.
Reminder, you should make sure that the stretcher is at the right angle to the foot of the bed, and the wheel of bed and stretcher is locked.
Okay. By the way, ma'am, this is student nurse Michael. He will be the one who assists you in your head, neck, and shoulder. And I will be the one who assists you in your abdominal part and your hip, while student nurse Jason will be the one who assists you in your side and feet. Okay? Just stay calm and relax. Okay, guys, just move forward your left. Okay, and bend. Count of 3, we're gonna slide our forearms. 1, 2, 3. 1, 2, 3, up. Next, we're gonna roll it. 1, 2, 3, roll. Okay, 1, 2, 3, pivot. Okay, guys, let's move. Careful. Okay, in count of 3, we're gonna move down. 1, 2, 3, down. Careful. careful. Okay, that's nice. Thank you guys for your help.
And lastly, make the patient comfortable and arrange linens. Transporting client from bed to chair and back to bed.
Good day, ma'am. By the way, I'm Cañadora, a student nurse from Asian College of Technology. As today's session, I'm going to transfer you to the wheelchair. So just stay calm and relaxing here so that I can get the wheelchair. Okay?
Bring the wheelchair to the client's room. Next, perform hand hygiene. Next, provide client privacy. Next, assess the client's condition. Pull off the client's blanket. Next, assist the client to move forward and sit on the edge of the bed and lean forward slightly from the hips. Next, put belt to the client's abdominal part for support. Next, place the foot of the stronger leg beneath the edge of bed and put the other foot forward. Next, assist the client to stand. Next, support the client to stand and then move together toward the wheelchair. You should make sure the wheelchair is locked and ensure the client's safety. Make sure the wheelchair is locked. Put a belt on the client's abdominal part. Grasp the client under the axilla from the rear and carefully move the patient to bed. Carefully remove the belt and put it into your abdominal part. Carefully lift the patient's both knees with the support of your left arm to the client's shoulder. And lastly, help the patient into his or her desired position and be sure the patient is comfortable when you leave. Moving able patient up in bed. After doing hand washing and explaining the procedure, pull off the client's blanket. Next, remove the pillow and place it on the head part of the bed. Next, ask the patient to flex his knees and cross his arm under his chest, or he could place his left arm on the nurse's shoulder. Then place your one forearm around the client's shoulder and other to his buttocks. Then carefully lift the patient. Next, return the pillow and see to it that the bed making is properly done. And lastly, make sure to leave the patient comfortable.